An illicit drug is a shapeshifter, as it can take on many forms. It can be seen as a way to socialize, used as a coping mechanism, or taken in a way to escape reality. But what happens when it starts to interfere with your everyday life? Drug addiction in Australia is a well-known secret. The abundance and variety of illicit drugs offered is plentiful, and greater than 40% of Australians have used illicit drugs in their lifetime. The stigmatization against those who use drugs is widespread, leaving many of these individuals to fall even further in their habit of drug misuse. Mental health and drug misuse often coexist. Drug use has many negative impacts such as memory loss, paranoia, and mood swings. Not only is a person's social and mental well-being affected, but so is their physical well-being. Injecting drug use, and in particular sharing needles, can result in the transmission of blood-borne viruses, including HIV, hepatitis B, and C. So what can be done to change this? There are two main approaches that governments and communities can implement to guide drug use: zero tolerance and harm reduction. Zero tolerance is a proactive approach which includes tough laws and penalties. Harm minimization is the current drug-related policy in Australia. Harm minimization strategies can be categorized into harm reduction, supply reduction, and demand reduction. The aim of harm minimization is that drug use is viewed as health-related rather than criminal or illegal issue. It follows the assumption that drug use may never be eradicated. Australia's most well-known harm reduction initiative is the Needle and Syringe Programs, otherwise known as NSP. NSPs were a response to the emergence of HIV and the identification of injecting drug use as a high-risk activity. In 1986, Australia's first NSP was trialled in Sydney. The role of NSPs include providing sterile injecting equipment and education. NSPs also assist people to address other health and welfare needs. NSPs do not supply drugs or allow people to inject drugs on the premises. Just in Australia, NSPs have prevented over 30,000 HIV cases and nearly 100,000 cases of hepatitis C. Countries across the globe are starting to implement NSPs too, and the benefits are clear. So where does that leave us? A decade ago, Australia had one of the biggest drug problems in the world. While illicit drugs are still a problem, changes in policy have drastically changed drug use within the country. Government policies are certainly influential to the health of individuals and the greater community. These have brought light to the health risks involved and reduced the stigmatization present around drug use. There's more to drug use than meets the eye. The Needle Syringe Program is a stepping stone for what we can do to reduce harm. Help us keep each other safe.